Today we're doing a showdown between the most popular supplement on the interweb right now, Berberine, and my personal favorite for lowering blood sugars, Fiber. We're going to see which one of these supplements really takes the cake when it comes to controlling your blood sugars and preventing and possibly treating diabetes. So thanks for watching. Let's get started and see which one of these two supplements is going to come out on top. All right, now let's start by setting some ground rules for this competition. We're going to grade each of these supplements based on 3 criteria. Number 1, efficacy. How good are they at lowering your blood sugars? Number 2 is tolerability. How easy are they to take? Can you take it on the go? Is it going to upset your stomach? Are there any other side effects you need to be worried about? And then the third criteria is other benefits. Outside of the blood sugars, what else are we doing throughout the body, and are we getting any other benefits from taking this supplement? And now, how are we going to grade them? We're going to grade them on a 5-point scale, from 1 being very little benefit to 5 being super awesome. All right, so now that we got the ground rules set, let's get started, and we're going to start with Berberine, the most popular supplement right now on the interweb. That is a completely arbitrary designation. I don't know if it's that popular, but it certainly seems to be. Now, the crazy thing is, I didn't even really learn about Berberine until I got really far into this kind of naturopathic slant to my practice. And once I did, I was like, this thing is the bomb. I mean, it's really amazing the way that it works, particularly in diabetes. All right, so let's start with a little background on Berberine. What is it? Well, berberine is a natural alkaloid compound that is found in a lot of different plants, but it has been used in Chinese medicinal culture for thousands of years. And actually, if you walk into a pharmacy in China right now, you would find berberine marketed as an over-the-counter drug used to treat different conditions. And here in the United States, I've seen it used for high cholesterol, and most recently, it's gotten billed as nature's Ozempic. And why is this? Because it kind of triggers some of the same receptors as metformin, or to a lesser extent, Ozempic, Wegovy, the other medications that are currently super hot now for weight loss. Now, we're not going to talk about Berberine's potential as a weight loss drug because I really want to focus on the blood sugars. This is where you're really going to see huge differences in your health outcomes if you can get your blood sugars down from that pre-diabetic or diabetic range down into something that is normal. And let's talk about the number 1 criteria, probably the most important thing to you and to me, is efficacy. How good is Berberine when it comes to lowering your blood sugars? And in this case, what we see is that Berberine is really off the charts when it comes to efficacy. There's a trial that showed that it is really powerful whether you're looking at newly diagnosed diabetes or whether you're looking at diabetics that are so poorly controlled they're on a ton of different medications. And when we add Berberine to both of those groups, either as initial first-line therapy or as the 5th-line therapy, what you see is dramatic improvements in blood sugars that are similar to what you see with medications. And let's start with the newly diagnosed diabetics. These are the ones where the hemoglobin A1C hit that 6.5, the fasting blood sugars are through the roof, and we need to start something. Now, most doctors would start you on metformin, which is the most commonly prescribed medication. It's been out forever, and it does a really good job on lowering your blood sugar. So these researchers compared starting patients on metformin versus starting them on Berberine, and what we saw was equivalent results. Berberine, 500 milligrams 3 times a day, was just as effective as metformin. Crazy. So we saw a reduction in the hemoglobin A1C of 2 solid points, from 9.5 starting hemoglobin A1C to 7.5, roughly the same as what you saw with metformin. And that was just during 3 months of treatment, 500 milligrams 3 times a day. So right off the bat, we're thinking Berberine's probably going to get a 5 on the scale for efficacy, because if you're just as good as a prescription medication, I mean, you got to get top billing for that as a supplement, right? And in fact, when we compare the actual numbers, what we saw was that Berberine lowered the blood sugars by just over 20% compared to 17% for metformin. So apples to apples, they were roughly equivalent, but you actually saw more improvement on the Berberine side. Incredible. And then when we look at the patients who had really bad diabetes and they were on multiple medications, and the consideration was, do we add another drug? So in this case, we just took this group of 46 patients and we said, instead of trying to take a fourth or a fifth drug, start taking the berberine, 500 milligrams 3 times a day. And in this case, we saw almost a solid point of reduction in the hemoglobin A1C. They went from 8.1 on multiple medications down to 7.3 without taking any more drugs, just the one berberine supplement. And these patients also saw significant improvements in triglycerides and cholesterol, meaning that you're getting all sorts of benefits throughout the body, which I'll remind you is one of the criteria for this competition. So we're really off to a good start, and already we can see there's solid evidence that if you are thinking that you want to start taking a natural supplement for your blood sugars, berberine might be the way to go. And in fact, you could argue just based on this much data that no matter where you are, whether you're pre-diabetic, diabetic, or even severely diabetic on multiple medications, that taking berberine might be a slam dunk no-brainer. But let's keep going. There's more. Now, I never like to make a determination based on just one trial, right? I mean, trials show good data, bad data. They can be poorly constructed or well constructed. So the meta-analysis is the way to look at one trial's data and then compare it to all the other trials that are out there and see, do other scientists come up with similar or the same findings? And in this case, what we see is that berberine does have a ton of positive data behind it. This is called a forest plot, which means we kind of plant all these studies on the graph and then we look, and anything to the left of the vertical line here is a trial that showed a positive benefit. So when we look at all of this data and we see these forest plots, it's clear that there's a lot of agreement that berberine is working for lowering your blood sugars. So I think at this point, it's fair to say that berberine is solidly taking a 5 out of 5 when it comes to efficacy. Nice job, berberine. All right, now we've done berberine's efficacy. Let's give fiber its fair shot. All right, so just in background, most of us Americans get about 16 or 17 grams of fiber a day. But when we increase the amount of fiber to 35 to 40 grams a day, research shows us that we can see a significant improvement in our blood sugars. And in fact, I've got a great video just diving into the role of fiber in lowering your blood sugars. I'll leave a link right here. Please go check it out if you're interested in lowering your blood sugars and you haven't seen it yet. Now, the way fiber works is it kind of creates a gel-like matrix in your intestinal tract, and it binds up sugars so they can't get to the receptors on the intestinal wall, and therefore it either blocks or slows the absorption of sugar, giving your body more time to process. So you don't have these huge spikes of insulin, you don't have these huge glucose infusions into your bloodstream. It gives your body time to manage sugar the way it was designed to do. And here's a graph from the New England Journal of Medicine showing that when you increase the amount of fiber in your diet, you see a significant and immediate reduction in your blood sugars. These two curves, the one on the top is without the fiber, the one below is with the fiber, and the taller the peaks, the more risk of diabetes, the more insulin spikes, the more glucose entering the bloodstream. So, and this is from the most credible journal in the United States, New England Journal of Medicine. You can't beat that. So just like berberine, we're really talking about something that is really efficacious, and we're thinking that maybe fiber might be in the running for a 5 out of 5 also on efficacy. But let's keep going. Here's another trial where we looked at patients who got about 14 grams of fiber a day in diet, and then we added 7 grams of fiber before breakfast and 7 grams of fiber before dinner. And what we saw were significant improvements in blood sugar morning, noon, and night. So even that lunchtime dose where we weren't taking the fiber supplement saw a significant improvement in our blood sugars. Here's a look at the graph of the dinner time readings with and without that extra fiber. And just like that article we saw from the New England Journal of Medicine, here we see that with the fiber, that area under the curve, that amount of glucose hitting the bloodstream is a lot less when we take the fiber. So how low did their blood sugars go when we went from 14 grams of fiber and then added 7 grams before breakfast and 7 grams before lunch? Well, we had a 13% reduction in the blood sugars after breakfast, a 60% reduction with our lunchtime blood sugars, which again is crazy because we didn't even take fiber before lunch. This is a carryover from those other doses, lowering that post-lunch blood sugar rise by 60%. And then we saw a massive 40% reduction with our dinner time readings. So 2 doses of fiber, 7 grams in the morning, 7 grams at night, has a significant reduction in lowering your blood sugars after meals. And it's doing it by binding up the sugar in your diet so that it doesn't hit the receptors, it doesn't get absorbed, and when it does get absorbed, it gets absorbed a lot more slowly. And then let's just look at one more trial where we went from 14 grams of fiber a day, same baseline as the last trial, and we increased that to 35 grams of fiber a day. And in this case, what we saw was an improvement in our hemoglobin A1C of anywhere from 2 to 2.4 percentage points. So that's like going from 8 to 6 or even 8 to 5.6. Crazy improvements, kind of similar to what we were seeing with that Berberine trial. And then our fasting blood sugars went down by 10 points, and we saw a significant improvement in insulin resistance such that the body became actually more able to handle those spikes in sugar as we add sugar and carbohydrate to the diet. It smooths out the absorption. We get less rise in our insulin level, and the body doesn't become as resistant to those spikes in insulin. So basically, we're normalizing all of those metabolic changes that we associate with diabetes. Super awesome stuff. Now, I'm not going to show you meta-analyses on fiber because there's a ton of them out there, and there's a lot of data showing that what I'm showing you here actually has been done hundreds of times. And again, I'll point you to my last video on fiber and blood sugars if you want to learn more. But right now, I'm inclined to give fiber a 5 out of 5. So after the end of round 1, we've got fiber and berberine duking it out for top place, and they're both scoring top of the charts on efficacy. So I'm going to give them both 5 out of 5. If you disagree, leave something in the comments. Happy to take your thoughts on it. But let's move on and let's talk about how tolerable both of these supplements are. Okay, let's start with berberine. Berberine's generally well tolerated, and it is certainly easy to take. It's just a little capsule that you take 500 milligrams 3 times a day. Super easy. But what about side effects? Well, there are a few side effects with taking berberine, and the good news is that they're generally short-lived, and you can generally alleviate them by starting with a lower dose and working yourself up. So, for example, you could start with 500 milligrams once a day, then after a few days, move up to twice a day, and then 3 times a day. But what are those side effects? Well, they're all kind of gastrointestinal related, and they occur at a rate of about 1/3 of patients will end up with either constipation or diarrhea or stomach upset or flatulence. And nobody wants to be flatulent. Nobody wants to have diarrhea. I mean, how are you going to get about your day if you are gassing up every room you go into? Not going to work.
Did you fart, Ray?
Fart.
Did you fart?
Fart.
The good news is that most of those side effects were resolved within the first 4 weeks. So if you started low, work your way up, and then stuck with it for those 4 weeks, maybe find a place where you're not going to be surrounded by other people, or maybe go around friends and family who will love you, even if you're a little gassy this week. After those 4 weeks, most of those side effects are gone, and now you're handling your blood sugars the way you want to with an easy supplement that you can take just 3 times a day. So I'm going to give berberine maybe like a 3 on tolerability, because you're going to have to really want to do it, and you're going to have to plan a little bit during those first 4 weeks. So tolerability, I think we're going to be around the middle of the ground there. All right, now let's look at fiber. Well, interestingly, fiber is largely suffering the same side effects as berberine. So when we look at the side effects that you get with fiber, it's a lot of that abdominal cramping, it's the loose stools, it's the flatulence. And when we think about it that way, what we see is that they're both kind of similar. Now, interestingly, the way we deal with the side effects of fiber supplementation is literally exactly the same way we deal with it for berberine. Now, we start low. Instead of taking 40 grams of fiber a day or 30 or 20, what I would say is start with 4 to 6 grams of fiber, start with that once a day, then add a second dose and a third dose. And then as you get more comfortable with it and your body adapts, which it will, then you can get to that point where you're adding a solid 15 to 20 grams of fiber a day to get you up to those levels of 30-ish grams of fiber daily that you need to see the best results on your blood sugars. So when we look at tolerability, what we see is that both of these supplements have kind of the same side effects in terms of gastrointestinal symptoms. They're both short-lived. Your body will adapt over the first few weeks, and you can mitigate those side effects by simply starting with a low dose and working your way up over several days to weeks as your body acclimates to the new supplement. So I know what you're thinking by now. We're 2/3 of the way through this head-to-head competition and we're tied. Am I completely blowing smoke here? Are we really just heading up for a tie after 20 minutes of talking? No, I promise you I'm going to give you a clear winner right here. And this is where we start to talk about the ancillary benefits of taking these supplements. We know we're going to get some good results on our blood sugars. That's for sure. We saw the data. And we know we're going to have to be a little careful and a little bit patient when we're starting these supplements in order to mitigate those risks of side effects. And we're going to have to just kind of work through them because we'll know that after the first month, we're not going to be dealing with those anymore probably. They're going to work themselves out. Our body's going to adjust. But now let's talk about, are we getting additional benefits from these supplements outside of the blood sugars? And here's where we start to see the comparison shift. Because berberine has some really good ancillary benefits. When we look at the trials on lowering blood sugars, we also see a reduction in LDL. We see a reduction in triglycerides, both of which are important factors that determine our health and particularly our risk of a heart attack or stroke. So we want to keep those in line, and berberine is helping. Now, when it comes to weight loss, I think the jury's out. There's a lot of anecdotal data out there showing that people are losing weight by taking berberine, kind of similar to that Ozempic story. But I haven't seen any real good research showing that that is the case. So it's all anecdotal. So I'm not going to give that a whole lot of weight. But right now we know that it's going to work on the blood sugar, the triglycerides, and the LDL cholesterol. Now, there's some also benefit in terms of longevity. There's ample research showing that metformin, the drug that's first-line treatment for diabetes, is associated with weight loss and longevity. It mimics the effects of fasting on the body to increase lifespan. So because it works the same way, berberine, on that pathway that metformin does, we can assume that we might get those same benefits in terms of longevity and weight loss. But again, the jury's out. There just isn't any data out there to say that that's the case. So I think at this point we can say that there's probably, we can give it a 3 or a 4 out of 5 on the berberine when it comes to ancillary benefits, because we are going to move down some markers that are associated with risk of heart disease and stroke. And we get these possible benefits in terms of longevity or weight loss, but there just isn't enough data out there to support it to give it that kind of 5 out of 5. We know this is going to be hitting all of these bases. And now let's turn our attention to fiber for the last segment of this video, where we see that fiber also lowers the same biological markers that berberine did. We get the reductions in blood sugars. We saw that. We also get reductions in LDL cholesterol, usually around 10%, and we get significant reductions in triglycerides. And it's all because of that same pathway where we're starting to bind up fats, cholesterol, and sugars in our intestinal tract and slow their absorption by the body. And we're also delivering a large prebiotic load to our colon. So we're all aware of the microbiome and how many trillions of bacteria are in our colon, living commensurately with us and helping us to kind of maintain optimal health. Those bacteria live on the undigested carbohydrate like fiber that makes it into the colon and avoids being absorbed in the small intestine. You see, when the prebiotic fiber reaches the small intestinal bacteria, they process that fiber and excrete short-chain fatty acids, which are then absorbed across the epithelial wall and serve to nurture those colon epithelial cells. And actually, those colon cells have evolved over years to preferentially operate on those short-chain fatty acids. So by delivering fiber to those bacteria, you're feeding them, creating that healthy microbiome, and also healthier cells that line the colon. And that leads to a lower risk of diverticulosis, a lower risk of colon cancer and colon polyps, and you're also getting other benefits throughout the body, such as a lower risk of heart disease, a lower risk of certain cancers, a lower risk of stroke. And of course, it's keeping your bowel regular, right? So we're supposed to be getting anywhere from 30 to 40 grams of fiber a day, but most of us are only getting around that 16 grams of fiber, which is the normal for an American. So by increasing our fiber intake, we're improving the health of our gastrointestinal tract, we're lowering our risk of heart disease, stroke, certain cancers, and improving the health of our colon, and we're lowering our blood sugars and cholesterol and triglycerides along the way. Now, what I think is that when you look at these two side by side, it's clear that fiber is having a significant effect throughout the body, and I'm going to give it a 5 out of 5, making it the winner in the Berberine Fiber Showdown. But that's not all. When we look at these two side by side, I think they both serve an important role. Berberine is easy to take. You pop one pill 3 times a day, no problem. And if you're looking for the easy button for lowering your blood sugars and getting some benefits along the way, such as lowering triglycerides, LDL, maybe some weight loss, then Berberine's a no-brainer. Definitely go for it. And the optimal dose is 500 milligrams 3 times a day. That's the dose that I showed you in the earlier trials. But fiber hits the root cause of why your blood sugars are going up, which is you've got too much carbohydrate getting absorbed too quickly and too often. Fiber binds that up, slows the absorption, and gives your body time to process it. That is why it's hitting the root cause, and you're getting a host of other benefits along the way, such as those reductions in risk of other diseases, the reduction in the cholesterol, and more regular bowels, which, better than being constipated and straining on the can all day long. So my recommendation would be to take them both. If your blood sugars are going up, there's no reason not to take both of them. Berberine, 500 milligrams 3 times a day, and fiber supplementation, working your way up to a total fiber intake of about 35 to 40 grams of fiber a day, which, if you're like an average American, means that you need to be getting about 15 to 20 grams through supplementation. You can split it up into 2 7-gram doses, 2 10-gram doses. You can have it all at once. Whatever it is that fits your routine. And just bear in mind as you're taking these supplements, start with lower doses, work your way up over time, keep an eye out for those gastrointestinal side effects. And if you feel them, then back off a little bit, take your time, work your way up, knowing that after the first month or so, you're probably going to have a nice response to it. It's going to be well tolerated, and you can manage your blood sugars for the rest of your life. So I hope you enjoyed this video. Stay tuned for my next one. And if you haven't seen that fiber video, check it out. Thanks for watching.